Hello and welcome to the course NCLEX RN Exam Strategies. In this section, we will discuss about the role of NCSBN and Board of Nursing to your application for the examination. So let's examine these two regulatory bodies and know about their respective roles. NCSBN, or the National Council of State Board of Nursing, is an independent, not-for-profit organization involved with the nursing regulatory bodies on matters concerning public health, safety, and welfare, including the development of nursing licensure examinations. They are the world leader in nursing regulatory knowledge. So if you plan to take the NCLEX examination, this is the first organization you need to know or familiarize with. As set by the NCSBN, nursing individuals should have a valid professional license to practice the profession. So the big question now is why? The purpose of a professional license is to protect the public from harm by setting minimal qualifications and competencies for safe entry-level practitioners such as you. Nursing is regulated because it is one of the health professions that possess a risk of harm to the public if practiced by someone who is unprepared or incompetent. A license issued by a governmental entity, such as the Board of Nursing, gives assurance to the community or to the public that we are practicing nurses have met the predetermined standards. Likewise, licensure benefits you and me because it outlines the scope of practice of our profession. Licensure also protects the use of our titles such as the RN after our names. So, what is now the role of the Board of Nursing in this process? Just like the NCSBN, the Board of Nursing in the US, states and territories were created to protect the public from the unsafe, incompetent, or even unethical practice of nursing. So the Board of Nursing achieved this mission by really establishing the standards for safe nursing care and issuing licenses to practice nursing as what I have discussed earlier. The Board of Nursing are responsible on 4 major tasks, and these are as follows. First, they are involved in evaluating licensure applications. The Board of Nursing review the information submitted in the applications for initial licenses, from new graduates of nursing programs or even for internationally educated nurses, and endorsement from nurses licensed in other states. The next is they are also involved in issuing licenses. So the Board of Nursing based licensure decisions from both initial licensure or licensure by endorsement on whether or not applicants meet all the requirements for licensure as set forth in the individual statutes and rules. Another task or responsibility is renewing license. So the Board of Nursing established procedures for nurses to apply for periodic renewal of their licenses. Some states require demonstrations of continuing educations, practice hours, or other activities as part of the renewal requirements. And lastly, they are also involved in taking disciplinary actions. Through a disciplinary process, the Board of Nursing may take action against the licenses of an individual nurse who violate laws or rules. Disciplinary actions taken by the Board of Nursing may include reprimand, probation, limited or restricted practice, suspend practice, and license revocation. So, I highly encourage you to better protect your hard-earned nursing license. So, as a recap, we discussed about the roles of NCSBN and Board of Nursing in your application and the reason why licenses are important for our practice.